Part 3 of our series on marijuana and mental health. This one looks at marijuana use, comorbidity, and treatment. Defining our terms, first of all, comorbidity means when one medical condition exists simultaneously with another medical condition. And you'll see examples of this in just a minute. But the idea that marijuana is a gateway drug, that it leads to harder drugs, there is little research to support this idea. We cannot say that it is a gateway drug. Correlation does not infer causation. People who use marijuana are the kind that tend to or would have access to other drugs or who have a propensity for drug use in the first place. So again, correlation does not infer causation. There is little research to support marijuana as a gateway drug. Some of the social detriments, we do know that early marijuana use is associated with poor educational outcomes, both in terms of grades and in terms of dropout rates. But again, these results, it's correlated with, associated with, correlation does not infer causation. They could be confounded by a lot of other variables, including mental health, poverty, which is the big one, adverse early childhood experiences, and social exclusion. Strong comorbidity, coexisting conditions between marijuana use and depression and anxiety disorder. However, does marijuana cause this, or do people with these conditions seek out marijuana as a form of self-medication? Again, there's a debate about the causal relationships. Many studies show that marijuana is used as a coping mechanism for people studying with anxiety disorders specifically. People who use marijuana had a 4 times greater rate of depressive symptoms, especially suicide ideation. That means thinking about suicide a lot. And again, correlation does not infer causation. Marijuana has not been shown to be a cause of this, okay? But it could again be people with depressive symptoms seek out marijuana as a way to deal with the symptoms. There is some evidence to support the consider of marijuana for anxiety disorder. And again, we mentioned that earlier in another video. But the research is far from conclusive here. Not yes, not no, but we just need more of it. Treatment. Half of daily adolescent users are likely to become dependent. If you are an adolescent and use it on a daily basis, half of you will become dependent on marijuana. In a 2006 study with 600 adolescents with marijuana use disorder, and the DSM-5 lists 10 substances for substance use disorder, and marijuana, cannabis, is one of them. But of these 600 adolescents, 77% had ADHD, 74 had conduct disorder, 38 depression, 29 anxiety disorder. And again, are they seeking out marijuana as a way to self-medicate or deal with some of these situations? We do not know. We do know that treatment of recurring mental health disorder improves the likelihood that an adolescent will either reduce marijuana use or abstain, treating the mental health condition. More likely that they'll reduce or abstain. We also know that marijuana creates barriers to the treatment of these mental health disorders. So we have to get rid of the marijuana use to deal with the mental health issues, but also dealing with the mental health issues helps improve the likelihood that an adolescent will reduce or abstain from marijuana use. All right, just a brief overview. Marijuana, mental health, research, there's far more questions than answers here, but there are some answers for sure. The big one, adolescents should not be using marijuana. Messes with the developing brain.